Hi, I'm going to talk about the value of urgent specialized care for TIA and minor strokes. My name is Marlon Santiago Granda Torres, and let's begin. With a little introduction, and first we have the definition of what is a stroke. A stroke occurs when the blood supply to a part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. Here is a little video that explains better what is a stroke.
A stroke is a medical emergency. Strokes happen when blood flow to your brain stops. Within minutes, brain cells begin to die. There are two kinds of stroke. The more common kind, called ischemic stroke, is caused by a blood clot that blocks or plugs a blood vessel in the brain. The other kind, called hemorrhagic stroke, is caused by a blood vessel that breaks and bleeds into the brain. Mini strokes, or transient ischemic attacks, TIAs, occur when the blood supply to the brain is briefly interrupted.
Symptoms of stroke are sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause.
If you have any of these symptoms, you must get to a hospital quickly to begin treatment. Acute stroke therapies try to stop a stroke while it is happening by quickly dissolving the blood clot or by stopping the bleeding. Post-stroke rehabilitation helps individuals overcome disabilities that result from stroke damage. Drug therapy with blood thinners is the most common treatment for stroke.
That was the video, and now we have the definition of what is a TIA. A TIA is a transient ischemic attack that is like a stroke, producing similar symptoms but usually lasting only a few minutes and causing no permanent damage. Here we have a little video that explains better what is a TIA.
TIA is a transient ischemic attack. It is a temporary interruption of blood flow to a particular part of the brain. The symptoms of TIA are indistinguishable from stroke. Both should be treated as a medical emergency. TIA can be challenging because in some instances the attack may only last 10 or 15 minutes. In those instances, people will be feeling better even before they call 911 or an ambulance arrives. The important aspect of TIA is that even if the symptoms clear on their own, a stroke can often follow a TIA, and therefore it should also be treated with similar urgency. So we recommend that all patients who have TIA also be evaluated in an urgent fashion in a stroke center, because the risk of a disabling stroke, a deficit that doesn't go away after TIA, is quite high. It may be as high as 10% within 48 hours of the initial attack. So we urge people to treat TIA as urgently as they treat stroke, even though the symptoms may clear on their own.
That was a doctor of the Mayo Clinic. Now we're going to talk about the medical applications. In medical application, we have that patients with vanishing symptoms may slip through our system for detecting acute stroke owing either to patients' delays in seeking medical attention or clinical assessment. that urgent treatment is not needed. There we have make applications specific for TIA. Transient ischemic attacks usually last a few minutes. Most signs and symptoms disappear within an hour. The signs and symptoms of TIA resemble those found early in a stroke and may include sudden onset of weakness, numbness, or paralysis in the face, slurred speech, and dizziness. A stroke. We have trouble with the speaking and understanding, paralysis on face, arm or leg, headache, and trouble with walking. Now we have applications in Ecuador. Studies have found that in 20 stroke patients, meaning aged 70 years, and the 60% were men, among 42 persons aged 40 years or less, stroke prevalence was 31.50%, that increases with age. Most patients have subcortical infarctions associated with leukocariosis or microbleeds and HCA, that mean arterial hypertension. The advantages of a TIA, I found that the only advantages is that knowing your risk factors and living, we can have a more healthy life, and are the best things that we can do to prevent TIA. Disadvantages, we have that strokes is the 5th leading cause of death in the United States, with 1 person dying every 4 minutes as a result. For Black people, stroke is 3rd leading cause of death. Finally, with the conclusion, we have that patients with minor strokes or transient ischemic attack, characterized as a brief episode of neurological dysfunction caused by focal cerebral ischemia, without infarction, have the less amount of disability and the most to lose should they have a stroke. Thanks.